The main purpose of modern day dentistry is to preserve the natural tooth and the jawbone. Whenever we plan to remove the grossly fractured tooth, we always discuss about the permanent replacement solutions to our patients. It is essential to get a proper replacement of missing tooth to keep the rest of your teeth aligned. Replacement of teeth also helps to maintain the shape of the face and avoid difficulties with eating or speaking. Two of the most common options are dental bridges and implants. In bridge, we prepare and reduce the size of the neighboring teeth to fix the bridge on top of it. But this design carries the inherent risk of weakening the natural tooth, which could lead to sensitivity, tooth fractures, and subsequent root canal treatments. The implant is placed inside the bone. It does not damage the neighboring tooth. It also helps in preventing jawbone loss at the replacement site. Dental implants require a minor surgical procedure. It can be done under local anesthesia in the clinical setup itself. They may not be an option for people with uncontrolled medical conditions, but if their medical condition stabilizes, implants can be done. Short implants with high success rates are available for patients with lesser height of jawbone. Generally, the final crown placement is done 3 months after the initial placement of implants. But in certain conditions, the implant and crown can be placed immediately after tooth extraction. With the availability of newer materials, designs, and techniques, implant expenses are comparable with that of dental bridges.